Welcome, everyone. I'm excited to kick off this presentation on antenatal care. Today, we'll explore important aspects of caring for pregnant women to ensure healthy pregnancies and healthy bobbies. We'll cover key topics like prenatal visits, nutrition, and warning signs to watch for. So, let's get started and delve into the essentials of antenatal care. Every year, approximately 200 million pregnancies occur around the world. That's a huge number, and it highlights just how common pregnancy is globally. Now, with so many pregnancies happening, it's important to recognize that each one carries some level of risk, both for the woman and her baby. While we can't completely eliminate these risks, the good news is that many adverse outcomes can be significantly reduced through effective maternity care. This care needs to start early in pregnancy, ideally as soon as a woman knows she's pregnant, and should continue at regular intervals throughout the pregnancy. Consistent, quality care is key to identifying potential issues early on and managing them appropriately. Connecting this to our overall discussion, it underscores the importance of accessible, acceptable, and continuous maternity services. These steps are vital in improving outcomes for mothers and their infants across the globe. Let's start by understanding what we mean by the term definition. Antenatal care, or care given during pregnancy, is essentially a planned process of examination and observation. It begins from the moment we confirm the pregnancy, that is, from conception, right up until the woman goes into labor. This care is crucial because it helps us monitor the health of both the mother and the developing baby. It allows us to identify any potential issues early on and ensure that both receive the best possible support. So, in simple terms, antenatal care is all about providing systematic and continuous care from conception to the start of labor. This concept is a key part of our overall focus on maternal and child health, aiming to promote healthy pregnancies and safe deliveries. Understanding this timeline helps us appreciate how vital consistent care is throughout pregnancy. Let's take a look at the objectives of our program. First and foremost, we aim to reduce maternal mortality and morbidity rates. This is crucial because ensuring the safety and well-being of mothers during pregnancy and childbirth is at the heart of our efforts. Next, we want to improve both the physical and mental health of women and children. A healthy mother often means healthier children, and addressing mental health is just as important as physical health in creating a supportive environment for families. Another key objective is to prevent, identify, and manage maternal and fetal abnormalities that can impact pregnancy outcomes. Early detection and intervention are vital here, as they can make a significant difference in both the mother's and baby's health. Finally, we are also focused on decreasing the financial resources required for maternal care. Making healthcare more accessible and affordable helps ensure that more women receive the care they need without undue financial burden. All these objectives work together to support our overall goal: improving maternal and child health outcomes and creating a safer, healthier environment for families. Let's start with the first key component of antenatal care services: the registration of pregnant women. It is crucial that a mother registers within the first 12 weeks of pregnancy. This early registration is vital because it allows healthcare providers to begin monitoring the pregnancy from the very beginning, ensuring both the mother's and baby's health are prioritized from the outset. By registering early, we can identify any potential risks or complications early on and provide the necessary support and interventions. This step is fundamental in the overall framework of antenatal care because it sets the foundation for a healthy pregnancy and positive outcomes. Remember, early registration is not just a formality. It's a proactive measure to safeguard the health of both mother and child throughout the pregnancy journey. Let's talk about antenatal visits, which are a crucial part of monitoring your pregnancy. Initially, you'll have a checkup every 4 weeks up to about 28 weeks of gestation. This helps us track your baby's growth and address any early concerns. Then, as you approach the 28-week mark, visits become more frequent, every 2 weeks until around 36 weeks. This increased monitoring is important because it allows us to catch any potential issues early on. From 36 weeks until delivery, you'll be visiting us weekly. This ensures that both you and your baby are doing well as the due date gets closer. Keep in mind, though, that if there are any abnormalities, complications, or warning signs during pregnancy, your healthcare provider may recommend more frequent visits. The key takeaway is that regular antenatal checkups are essential for a healthy pregnancy, and the frequency will be adjusted based on your individual needs and circumstances. Let's talk about the health center level and what the World Health Organization recommends for antenatal care. The WHO advises that all pregnant women should have 4 antenatal visits during their pregnancy. These visits are crucial for spotting and treating any problems early on, as well as providing necessary immunizations to protect both mother and baby. The first visit typically happens when pregnancy is confirmed. This is an important opportunity to establish a baseline and begin monitoring the pregnancy. The second visit is scheduled between 20 and 28 weeks, which allows us to check on the progress and address any concerns. The third visit should occur between 34 and 36 weeks, giving us a chance to prepare for delivery and handle any last-minute issues. The fourth visit is ideally before the expected date of delivery, or whenever the woman feels she needs to consult a health worker. It's also essential that every woman keeps a record file where all events and checkups are documented. If the pregnancy proceeds without complications, these 4 visits are usually enough. But of course, if any complications arise, additional visits may be necessary to ensure both mother and baby stay healthy. Overall, these visits are a key part of ensuring a safe pregnancy and delivery, and they help us catch potential problems early, making a big difference for maternal and newborn health. Let's take a closer look at assessment and examination. These are crucial steps in understanding the overall health and progress of the individual or system we're working with. When we talk about assessment, we're referring to the process of gathering detailed information. This could be through interviews, questionnaires, observations, or physical examinations. The goal here is to get a comprehensive picture of the current state. Examination, on the other hand, often involves more hands-on evaluation, like physical tests or diagnostic procedures, to verify and expand on the data we've collected. Both assessment and examination are interconnected. They help us identify strengths, weaknesses, and potential areas that need intervention. It's important to remember that these steps aren't just about collecting data. They're about understanding context and setting a baseline. This allows us to tailor our approach effectively and track progress over time. Throughout our overall process, assessment and examination serve as foundational elements that inform every decision we make, ensuring that we're providing the most accurate and personalized support possible. Vamos falar sobre historia clínica, que acute uma etapa fundamental na avaliação do paciente. Primeiro, coltamos os dados de identificação, como nome, idade e contato. Em seguida, perguntamos sobre as queixas principais, ou seja, o motivo pelo qual o paciente procura atendimento. E acute importante entender a história atual de doença, ou seja, como os sintomas começaram e evoluíram até o momento. Depois, revisamos o histórico médico passado, incluindo doenças anteriores, cirurgias realizadas e imunizações. Não podemos esquecer de história na infância, muitas condições podem ter raízes lá. Perguntamos também sobre alergias, pois elas influenciam no manejo do paciente. A história pessoal inclui hábitos de vida, como o uso de drogas, alimentação, padrões de sono, higiene e hobbies, pois esses fatores impactam na saúde geral. Conhecer esses aspectos ajuda a manter uma abordagem mais completa e personalizada para o cuidado. E, claro, tudo isso está conectado ao tema geral de compreender o paciente de forma holística para oferecer o melhor tratamento possível. Now, let's look at the menstrual history, which is a crucial part of understanding a woman's reproductive health. We'll start with the age of menarche, which refers to the age when she had her first period. This can vary widely among women and can give us insights into her hormonal development. Next, we consider the menstrual cycle itself, its regularity, frequency, and any irregularities. The cycle length is important, as normal cycles typically range from 21 to 35 days, but variations can occur. We also need to note the duration of bleeding, which usually lasts about 3 to 7 days. LMP, or the last menstrual period, helps us establish a timeline and assess any recent changes. Dysmenorrhea, or painful periods, is another key point, as it can indicate underlying conditions like endometriosis or hormonal imbalances. Moving beyond menstruation, the marital history provides context about her reproductive life. We look at her age at marriage and the type of marriage, whether it's monogamous or involves multiple partners, as these can influence reproductive health. The number of children she has borne is also significant, as it can impact her overall health and fertility. We should also inquire if she experiences any sexual disorders, as these can affect her quality of life and relationships. Lastly, her relationship with her husband is an important aspect to understand, since emotional and physical intimacy often play roles in her reproductive and mental well-being. All these points are interconnected and help us form a comprehensive picture of her health, guiding us toward appropriate care and management. Let's now look at the patient's past obstetrical history, which is an important part of understanding their overall health. We'll consider the mode of delivery, whether they have had any stillbirths or abortions, and the year of their last delivery. Additionally, noting the number of live births provides insight into their reproductive history. It's also crucial to assess the health of their family members, parents, siblings, spouse, and children, as this can reveal hereditary or genetic factors that might influence their health. Family medical history, including any chronic illnesses or conditions, as well as surgical history, gives us a broader picture of potential risks. Creating a family tree helps visualize these relationships and health patterns, which can be very useful in identifying inherited conditions. Lastly, understanding the environmental history, exposures, living conditions, and lifestyle factors is essential, as these environmental influences can significantly impact health outcomes. All these elements together help us build a comprehensive picture of the patient's background, guiding us toward more personalized and effective care. Let's now turn our attention to the physical examination. This step is crucial because it helps us gather important clinical clues. During the exam, we want to perform a thorough, systematic assessment. This includes inspecting the patient visually for any obvious signs, palpating areas to feel for abnormalities, and auscultating with a stethoscope to listen to the heart and lungs. It's important to remember that the physical exam isn't just about identifying abnormalities. It also helps us understand the overall health status of the patient. For example, noticing signs like cyanosis or edema can point us towards specific diagnoses. Connecting this to the broader theme, a careful physical exam can sometimes provide immediate insights that guide our next steps in diagnosis and management. It's a vital component that complements history taking and helps us build a complete clinical picture. Now let's take a look at the physical examination, which is a crucial part of monitoring the health of a pregnant woman. First, we consider vital signs. These include temperature, respiration, pulse, and blood pressure. Monitoring these regularly helps us ensure both mother and baby are doing well. Temperature tells us if there's any fever, which could indicate infection. Respiration rate can reveal respiratory issues or distress, and pulse helps us assess the heart rate and circulation status. Blood pressure is especially important. High blood pressure can signal conditions like preeclampsia, so keeping it in check is vital. Moving on to anthropometric measurements, we focus on height and weight. Height usually remains constant, but weight is a key indicator during pregnancy. On average, a woman gains about 9 to 11 kilograms throughout her pregnancy. This weight gain supports the developing fetus, placenta, and other physiological changes. Understanding these measurements helps us track the progress of the pregnancy and ensures that maternal health is maintained. It all ties back to our overall goal, promoting a healthy pregnancy for both mother and baby. Now let's move on to the head-to-foot assessment, starting with the breast inspection. When examining the breasts, it's important to observe the shape, whether it's symmetrical and natural looking. Next, look at the nipple shape, whether it's round or oval, and note any abnormalities. Be attentive to signs of dryness or cracking, which can indicate irritation or other issues. Also, check for scar formation that might suggest previous surgeries or procedures. Enlargement of the breasts or any noticeable changes should be carefully documented, as these could be signs of underlying conditions. Remember, a thorough inspection is key to identifying early signs of problems and ensuring comprehensive patient care. Let's move on to inspecting the abdomen. First, we'll look at the size to get an idea of the overall health and any potential abnormalities. Next, we assess the shape, whether it's round, flat, or distended, which can tell us a lot about the underlying condition. Then, we check for any skin changes, such as the linea nigra, which is a dark line that often appears during pregnancy, indicating hormonal changes. We also inspect for any scars on the abdomen, noting their location and healing status, as scars can reveal past surgeries or trauma. Finally, we observe fetal movements if the patient is pregnant. Feeling these movements can give us important information about the well-being of the fetus. All of these inspection points are vital in forming a comprehensive picture of abdominal health and guiding further assessment or intervention. Now let's talk about palpation, which is a vital part of fetal assessment. First, we have abdominal girth, where we measure the size of the abdomen to get an idea of fetal growth and amniotic fluid volume. Next is the measurement of fundal height, which helps us estimate how far along the pregnancy is and monitor fetal growth over time. Fundal palpation involves feeling the top of the uterus to assess its size and position, giving us clues about fetal development. Lateral palpation is when we move around the abdomen to determine the fetal position and orientation, which is important for planning delivery. Pelvic palpation, on the other hand, allows us to assess the engagement of the fetus in the pelvis and check for any abnormalities. Moving on to auscultation, the first key point is listening to fetal heart sounds. This is crucial because it tells us about the fetal well-being and oxygenation. We also assess the fetal lie and presentation, which means determining how the fetus is positioned, whether head down, breech, or transverse, and how it's oriented within the uterus. All these palpation and auscultation techniques are interconnected and help us form a comprehensive picture of the fetal health and position, guiding us in making informed decisions throughout the pregnancy. Now, let's move on to discussing some key aspects of physical assessment. First, we'll look at the genital area. It's important to observe hygiene and look for any tenderness that might indicate discomfort or infection. Additionally, the Chadwick sign, which is a bluish discoloration of the cervix, can be an early indicator of pregnancy. Next, we'll examine the extremities. Assessing range of motion is crucial because it helps us identify any limitations or pain that could suggest underlying issues. Speaking of pain, always pay attention to any reports of discomfort, as it guides our evaluation. We also need to be aware of leg cramps, which are common in pregnancy and can cause significant discomfort. Edema or swelling, particularly in the legs and feet, is another key point to monitor. It can be normal to some extent, but excessive swelling might require further investigation. By paying close attention to these areas, we get a comprehensive picture of the patient's overall health and well-being, which is essential for providing the best care during pregnancy. Let's go through the various investigations that are typically done in this context. First, we have laboratory investigations, which are crucial for assessing the overall health status. HB estimation helps us understand the hemoglobin level, indicating anemia or other blood disorders. Blood grouping and Rh typing are essential for safe blood transfusions and pregnancy planning. Urine tests provide information about kidney function and detect infections or other abnormalities. We also perform VDRL tests, which are important for syphilis screening, and RBS or random blood sugar tests to check for diabetes. HB's AG testing is vital for hepatitis B screening, especially in pregnancy. An ultrasound, or USG, is used specifically for pregnancy confirmation and monitoring fetal development. Profile checks, including stool and urine analysis, help us detect infections or the presence of albumin, which can indicate kidney issues. If the facility is available, a pap test can be performed to screen for cervical cancer. Additional investigations include chest X-rays, which might be necessary depending on symptoms, and tests for gonorrhea and HIV, especially if there's a risk or suspicion. All these investigations are connected to our overall goal of ensuring maternal and fetal health, and they help us identify any issues early on so we can manage them effectively. During pregnancy, the daily caloric requirement is about 2,500 calories. It's important for women to focus on a balanced diet that includes plenty of vegetables, fruits, proteins, and vitamins. At the same time, they should try to minimize their intake of fats. The main purpose of good nutrition during this time is to support the growing fetus, of course, but also to maintain the mother's health. Proper nutrition helps her build physical strength for labor and ensures successful lactation after birth. By paying attention to these dietary guidelines, we can promote healthier pregnancies and better outcomes for both mother and baby. Now, let's talk about health teaching and counseling during pregnancy. This is a crucial part of promoting a healthy pregnancy and ensuring both mother and baby are well cared for. It all starts with reviewing basic aspects of daily life that can impact health. First, hygiene is essential. Maintaining good personal hygiene helps prevent infections. Sleep is another key area. Adequate rest supports the mother's overall health and helps her manage stress. Breast care is important too, especially as the breasts prepare for breastfeeding, so we discuss proper support and hygiene practices. Dental care shouldn't be overlooked. Regular dental checkups and good oral hygiene are vital since oral health is linked to overall health and pregnancy outcomes. Dressing appropriately is also necessary. Wearing comfortable, breathable clothing and avoiding overly tight garments can help prevent discomfort and circulation issues. Travel considerations are next. Pregnant women should plan travel carefully, avoiding risky situations or long journeys when possible. Sexual activity is a personal choice, but it's important to discuss any concerns or discomforts to ensure safety and comfort. Finally, exercises are beneficial. Gentle, pregnancy-safe exercises can boost mood, improve circulation, and prepare the body for labor. All these elements are interconnected and contribute to the overall goal, supporting a healthy pregnancy and a positive experience for the mother. Remember, education and counseling empower women to make informed choices every step of the way. Let's talk about hygiene, which is an essential part of maintaining good health. Daily all-over washing is necessary because it helps keep you feeling stimulated, refreshed, and relaxed. It's a simple routine that can really boost your overall well-being. However, it's important to remember that hot baths should be avoided. They can sometimes cause fatigue or even lead to fainting, so lukewarm water is a safer choice. Regular washing of specific areas like the genital region, underarms, and breasts is also very important. These areas tend to have increased discharge and sweating, which can lead to discomfort or infections if not cleaned properly. When it comes to vaginal douches, it's best to avoid them unless there's an issue like excessive secretion or an infection. Overuse or unnecessary douching can disrupt the natural balance and cause more problems than it solves. Overall, good hygiene practices are a key part of maintaining your health and feeling your best every day. Let's talk about breast care. It's important to wash the breasts gently with clean tap water. This helps keep the area clean and reduces the risk of infection. Now, it's best not to massage the breasts. Why? Because massage can stimulate the secretion of oxytocin, which may cause the breasts to contract. That contraction isn't ideal in the early stages of breastfeeding. Also, I want to emphasize the importance of mental preparation. Encourage the mother to be mentally ready for breastfeeding. A positive mindset can really make a difference in the success and comfort of breastfeeding. So, in summary, gentle cleaning, avoiding massage, and a prepared mind are key points here. These steps support a smooth start to breastfeeding and help both mother and baby have a positive experience. Let's talk about dental care during pregnancy. It's really important to keep your teeth clean and healthy. Make sure to brush your teeth carefully in the morning and after every meal. This helps remove plaque and prevents cavities. Encourage the woman to see her dentist regularly for routine examinations and cleaning. Regular checkups are essential because they allow the dentist to catch any issues early and keep her oral health in top shape. If a tooth needs to be extracted during pregnancy, it's generally safe, but local anesthesia is recommended. This minimizes any risks to both mother and baby. Remember, good dental care isn't just about the teeth, it's also about overall health, especially during pregnancy. Maintaining oral health can prevent complications and contribute to a smoother pregnancy experience. When it comes to dressing, it's important to choose clothing that promotes comfort and good circulation. Women should avoid wearing tight clothes like belts or bands on the legs, as these can restrict blood flow in the lower extremities, possibly leading to discomfort or circulation issues. Additionally, selecting the right footwear is key. Shoes with a moderate to low heel are preferable because they help minimize pelvic tilt, which can reduce the risk of backache and promote better posture overall. And of course, loose and light clothing tend to be the most comfortable, especially when you're trying to maintain ease of movement throughout the day. Remember, dressing appropriately not only contributes to comfort, but also supports overall health, which aligns with our goal of promoting well-being in our daily routines. Let's talk about travel during pregnancy. Many women have questions about this, and it's a really common concern. Early in pregnancy, especially during the first trimester and into the second, there are generally no restrictions on travel. You can usually go ahead with your plans, but it's always good to check with your healthcare provider first. As pregnancy progresses into the later stages, things change a bit. Travel plans should then be more carefully considered, mainly because of the increased risk of early labor. It's important to think about how far along you are and whether your destination has suitable medical facilities in case you need care unexpectedly. So the key takeaway here is that early pregnancy is usually safe for travel, but as you get closer to your due date, you should be more cautious and plan accordingly. This helps ensure both your safety and that of your baby, which ties back to our overall goal of promoting healthy pregnancies and safe deliveries. Let's talk about sexual activity during pregnancy. It's important to know that sexual intercourse is generally safe and normal as long as it's done in moderation. Of course, there are some exceptions to keep in mind. If there are specific problems, like vaginal bleeding, or if the membranes have ruptured, it's best to avoid sexual activity until your healthcare provider gives the go-ahead. For women with a history of abortion, it's advisable to avoid sexual intercourse during the early months of pregnancy. This is a precaution to help protect the pregnancy during its initial stages. Overall, the key is moderation and awareness of your body's signals. If you experience any unusual symptoms, consult your doctor. Remember, maintaining a healthy and open dialogue with your healthcare provider is essential for a safe pregnancy journey. Now, let's talk about exercises during pregnancy. It's important to keep them simple and safe. Walking is an excellent choice because it helps maintain fitness without putting too much strain on the body. However, I recommend avoiding long periods of walking, as it can lead to fatigue. When it comes to lifting, pregnant women should steer clear of heavy weights like mattresses or furniture. Lifting such heavy objects can increase the risk of complications, including miscarriage. Standing for extended periods is also not advisable because it can predispose you to varicose veins, which are common during pregnancy. Lastly, try to avoid sitting with your legs crossed, as this can impede circulation. Proper circulation is vital for both your health and your baby's development. Remember, the goal is to stay active safely and avoid activities that could cause harm. Keeping exercises simple and mindful helps ensure a healthy pregnancy. The purpose of exercises during pregnancy is truly multifaceted. First, they help us develop and maintain good posture, which is essential as our bodies change and adapt. Proper posture not only relieves discomfort, but also supports overall well-being. Additionally, regular exercise can reduce common pregnancy issues like constipation and insomnia, making daily life more comfortable. It also helps alleviate back aches and fatigue that often come with carrying extra weight and shifting center of gravity. Another key benefit is ensuring our muscles stay toned and strong, especially the pelvic supports, which are vital for a healthy pregnancy and delivery. Developing good breathing habits through these exercises is also crucial because it guarantees an adequate oxygen supply to the fetus, supporting healthy growth. Lastly, exercise helps prevent circulatory stasis, especially in the lower extremities. By promoting better circulation, we reduce the risk of venous thrombosis, which can be a serious concern during pregnancy. All of these points tie back to our overall goal: maintaining health, comfort, and safety for both mother and baby throughout this important journey. Today, I will walk you through the different types of exercises that are essential for maintaining overall health and well-being. First, let's talk about breathing exercises. These are fundamental because they help improve lung capacity and oxygen flow throughout your body. Next, we have circulatory exercises, which focus on enhancing blood flow. These include leg and shoulder exercises that stimulate circulation and keep your limbs healthy and active. Moving on, we have stretching exercises. These are crucial for flexibility and preventing injuries. We'll cover stretches for the legs, arms, and neck, each targeted to keep those areas limber and relieve tension. Then there's abdominal exercise, which is vital for core strength. A strong core supports your posture and overall stability. We also include pelvic tilting and back stretching exercises, which are excellent for relieving lower back pain and improving spinal flexibility. Pelvic floor exercises, like Kegel's exercises, are key for strengthening those muscles that support your bladder and bowel function. Transverse exercises focus on deep abdominal muscles, helping to stabilize your core from within. The Taylor sitting exercise, or seated cross-legged position, promotes hip flexibility and comfort during prolonged sitting. Finally, the hip hitching exercise is designed to enhance hip mobility and reduce stiffness. All these exercises, when integrated into your routine, contribute to a balanced approach to physical health, supporting your overall theme of wellness and prevention. Let's talk about sleep during pregnancy. It's really beneficial for the pregnant woman to take some time to lie down and relax or even sleep for about 1 to 2 hours in the afternoon. This rest helps support overall well-being and can reduce fatigue. Now, at night, it's important to aim for at least 8 hours of sleep. As the pregnancy progresses towards term, increasing sleep duration can be especially helpful. This is because the highest level of growth hormone secretion happens during sleep, which is vital for the baby's development and the mother's health. To promote better sleep, I often advise using natural sedatives. For example, a warm bath can help relax the muscles and calm the mind. A glass of warm milk is another gentle option, as it contains tryptophan, which can help induce sleep. Overall, prioritizing quality sleep is an essential part of caring for both mother and baby throughout pregnancy. Let's talk about some essential supplements during pregnancy, starting with folic acid. Folic acid is a vital vitamin involved in cell growth and division, which is especially important during pregnancy to support the developing fetus. The typical dosage is 400 micrograms daily, but if a woman has a higher risk of neural tube defects, the recommended dose increases to 5 milligrams per day. Next, iron plays a crucial role as well. It's needed during pregnancy to produce hemoglobin in red blood cells, helping to prevent anemia and ensure both mother and baby get enough oxygen. The standard dosage here is about 30 milligrams of elemental iron each day. Finally, calcium is essential for the development of the baby's bones, as well as for the proper functioning of muscle and nerve cells. Adequate calcium intake supports the overall growth and health of the fetus. The recommended dose is around 500 milligrams taken orally daily. Together, These supplements are key to supporting a healthy pregnancy and ensuring optimal development for the baby. This slide doesn't contain enough information. That's why we're moving to the next slide.